Hey everyone, Rick MacDermid here with Senior Solutions Group, and I just want to thank you for taking the time to check out this video. We're going to talk to you about how you could save the most on your Medicare Part D prescription drug cost. And this afternoon on Friday, and we are here just getting ready to head out for the weekend, so wanted to put together this video for you because there's some good information we want to pass your way. So we were helping a gentleman down who's turning 65 this November, on November of this year, 2020, and he gave us a list of his medications and we entered them in for him, and we also put in his pharmacy, and we found some options for him to consider for his Part D drug cost. So one thing we'll do is whenever we help our clients, we want to make sure that we are getting accurate information. We have the option to import your drugs directly from your pharmacy, or if you want to list them off, we could type them in, or you have the option of using our website at seniorsolutions.net. When you click insurance plans, you have the option to enter your own drugs on your own as well and find out what the cost would be at your pharmacy. The other option would be to go to medicare.gov. We do carefully screen and vet all the drug plans we work with. We don't represent every single drug plan. I don't know of any agent. I know there's no agents that do. So we want to make sure that, full disclosure, we don't represent every single one. We want to help you as best we can if you have questions about how this all works. Medicare Part D can be very, very confusing. So let's take a look at his drug list. We've got metformin, atorvastatin, amlodipine, furosemide, losartan, metoprolol. These are all generic standard drugs. Tamsulosin, which is generic Flomax, finasteride, and adapalene gel, which he only uses and refills as needed. So about once a year he gets refills. So we entered in his Safeway pharmacy, which is the one he uses, and we'll get the quote. So one thing we have is a tool that will help us compare all the plans instantly. There's about 28 different drug plans in this market where he lives, and you'll see there's different companies that offer Part D drug plans. We've got WellCare, Cigna, Envision Rx, Humana, WellCare, another WellCare. WellCare has 6 different plans in this market. Humana has 3 plans, SilverScript has 2, Cigna has 2, WellCare again, Mutual of Omaha, and United Healthcare AARP, as well as Mutual of Omaha. So we got a number of different options to pick from. The number here, the $15.70 a month, that is just one part of the equation. You don't necessarily want to pick the cheapest plan unless you're on no drugs or maybe 1 or 2 generic drugs. In this case, he's on 8 or 9 different drugs, so you want to take the time to make sure you're on the best plan for you. Over here on the right, you'll see the total estimated cost if you were to refill those drugs starting in November of 2020. When we click Plan Details, we'll see what each and every drug is going to cost when you refill it at your pharmacy. So in this case, it's Safeway Pharmacy. And you'll see 00003, $1.47, 0076, and $297. Finasteride and adapalene are not on the formulary. They are not covered. You can see they're not on the list. There is not one drug plan that's going to cover every single drug that's covered under Medicare. So you want to make sure that you are aware of that when you enter in your medications. So we can, couple options here, we can not take those drugs, or talk to your doctor about alternatives, or talk to the plan manufacturer to see if there are discounts through the manufacturer, or have your doctor file an appeal with the drug plan itself. There's no guarantee though that the plan will authorize those drugs that are not covered. So what's another option? Well, there's a different option called GoodRx, which many of you may have heard of. So on your smartphone, if you have an iPhone or an Android phone, you can download the GoodRx app, and it's free. And you can see at Albertsons or Safeway, finasteride would be $7.85, which is an 89% discount versus $76.42. So that is one way to save money, is you can use the GoodRx app to possibly save a good chunk of change if your drug is not covered or if you're paying a high copay. The other drug that we looked up that was also not covered is the adapalene gel, which he only gets once a year on average. Well, how does $42 or $51 sound versus $297? That's a big difference as well. So you can really save a lot of money if you use the GoodRx tool in many cases to dovetail with your Part D drug plan. So that's just another tip for you to use. Thank you for taking the time with us today. If you have any questions, feel free to reach out to us, and do subscribe, if you would, to our YouTube channel to get this information out to as many people as possible who could benefit from it. Thanks a bunch.